After I graduated with my degree in psychology, I moved across country and I wasn't really sure what I was going to be able to offer. I still didn't have a degree that was enough to become a licensed therapist, but I wanted to jump in as quickly as I could and get started being of service. I found a position as a peer support specialist, which gave me a whole other perspective of what I was going to be able to do for people. A peer support specialist, because many people don't know, is someone who identifies with a service as having been a client or a patient, an end user, so to speak. So I was able to find a job where, because of my own diagnosis, because of my own experience with mental health medications, I was able to support other people who were in the same boat. I worked at a crisis center, which happened to be located between a physical medical hospital and a mental health center. And the reason they created this was because if there wasn't an appointment available at the mental health center, but someone was still in crisis, oftentimes they would end up in the emergency room at a medical hospital where they didn't have the ability to support someone who was having a mental health crisis. So they created a crisis center where I was able to use my education, my personal experience, and support other people who were maybe going through some of the same things that I'd already been through. And that gave me my second perspective on how I could start to become of service to people struggling with mental health issues. The third way that I was able to find myself and my calling was to go to work for a clubhouse. A clubhouse model is based on rehabilitating someone who has been diagnosed with a severe or chronic mental illness. And it's the same community of people that I had met when I interned at the mental hospital, the same community of people that I was able to serve as a peer support specialist. And now I was able to become involved with this same community. But the environment is so different, and it's so beautiful, and it's so impactful. It's completely different than what I had experienced in any other of the support positions I was in. Now, this gives me the perspective from being a client or patient to being a peer support, and now as a mental health professional, I was able to see how to support people in ways that helped them to just flourish. The community that's built when people are treated like they're humans, when they're seen and heard in the capacity that they deserve, it's a beautiful, beautiful experience. And it also gave me the opportunity to see that there's a whole community of people that are getting no services at all. This is why I've created Thistle Coaching.